Do you have a torn ACL? Oh my god, you need surgery. Nope. Did you know that surgery might not just be delaying your recovery time but also lead to re-injury? Let's understand why the scalpel might not be the hero and how you soon can get back to running, jumping, playing after your ACL tear. Welcome back to my channel, guys. Today we'll be learning about how you can improve your knee anterior cruciate ligament or ACL injuries without any surgery. ACL or anterior cruciate ligament is a ligament that joins your thigh and leg bone for stability at the knee. It holds things together and provides support during intense maneuvers. It has always been assumed that once this ligament is ruptured, they cannot heal. Traditionally, surgery was seen as the golden ticket to fixing them. But hold your scalpel, guys. Recent studies and success stories have actually started challenging this age-old belief. Turns out, non-surgical treatments like physiotherapy alone can actually work wonders. A tailored rehab plan designed by experts help in healing the ACL, focusing on strengthening the surrounding muscles around the knee joint, enhances stability, as well as gradually restores the knee's functionality to get back on the field ASAP. Building muscle strength around the ACL also reduces the chances of re-injury and has faster return to activity. The focus areas to work on are: number 1, lower peak knee flexion angle. This can be worked on by strengthening the hamstrings. Number 2, lower internal knee extension moment. This can be improved by improving the quadriceps action. And 3, lower rate of internal knee extension moment by improving the motor control at the knee joint. But why no surgery? A 2021 British Journal of Medicine study was done on 167 ACL clients. In the early ACL reconstruction, that is the surgery groups, there were 4 re-ruptures and 3 ruptures of the good knee after 1 year versus 2 re-ruptures at the bad knee and 1 rupture of the good knee in the rehabilitation group. So re-ruptures were actually higher in surgery. Another evidence also suggested that not only can surgery be avoided, but 32 ACLs spontaneously healed with the bracing protocol, which actually led to reduced time to getting back to the field. The cross bracing protocol managed 4 weeks of ACL rupture with the cross bracing. The knee was fixed at 90-degree inflection and the brace was kept for 4 weeks, followed by progressive increase in range of motion until brace removal at 12 weeks. And they followed physiotherapist-supervised goal-oriented rehabilitation to improve this. How did they do this? Let's dive into the exercises and the bracing technique in the ACL rehab. First, starting with week 1 to 4, range of motion brace was fitted and locked at 90 degrees. Non-weight bearing is continued with crutches maintaining the 90-degree knee bend. Number 1, start with quadriceps and hamstrings co-contraction. Number 2, calf theraband plantar flexion. Number 3, hip abduction and hip extension maintaining knee at 90 degree. Number 4, the uninjured leg will continue with single leg press, leg extension, hamstring curls, calf raises, glute bridges as well as core activation. Number 5, continue all of the upper body strength training exercises in the meantime. Now coming to week number 5, the brace is maintained from the knee angle between 60 degrees to 90 degrees of bending. And week 6, it is progressed to 45 degrees to 90 degrees. Non-weight bearing with crutches is continued along with the exercise. Brace can come off while doing physiotherapy and same exercises are continued. Week 7 to 8, brace is maintained at 30 degrees to full flexion and week 8, 20 degrees to full flexion or bending with partial weight bearing with crutches. Start with number 1, wall squats, number 2, body weight squats within the brace limits. Week 9 to 10, brace can be maintained at this. Number 1, knee range of motion exercises, that is heel slides with a sock under the foot over slippery surfaces can be done. And number 2, start with your leg press. Number 3, body weight squats. Number 4, gluteal bridges. Number 5, crab walks or monster walks with bands. Number 6, calf raises. Number 7, static balance exercises. Number 8, an exercise bike if the person is able to achieve over 100 degrees of knee bending. Week 10 to 12, unrestricted range of motion. The brace is fixed from 0 to 120 degrees and exercises include leg press but single leg. Hamstring curls. The machine can be started for the injured leg, standing calf raises, static balance exercises as well as exercise bike. Week 13 to 14, brace is removed and we plan a clinical review and repeat the MRI. Exercises should be focusing on improving muscle strength as well as proprioception. We go forward with the addition of single leg squatting Bulgarian squats. Along with that, lunges added, dynamic balance exercises, ball throw and catch, as well as jogging on the spot can be started. If they are doing well, light skipping can also be included. Week 15 to 16, there's no brace and full weight bearing can be started by the person. We also introduce running. Important to note that there should be no swelling, full range at the knee, quadriceps and hamstring strength should be more than 80% of the other leg. Star excursion balance test should also be more than 80%. Addition of walking, lateral movements like crab walking and side stepping can be added. We can also add jumping and landing exercises. Along with this, exercise bike is continued and can start cross trainer or elliptical. Please start straight line running as well. Now week 17, we continue or progress the previous exercises and introduce faster running. Week 18, we introduce adequate control with jumping and landing as well as double and single leg jumps. We should be able to complete faster straight line running with no pain or swelling by this week. Coming to week 19, we introduce hopping exercises. Week 20, single leg hop. Hamstring strength and knee strength should be more than 90% of the uninjured leg. Good dynamic knee control on the single leg land from step as well as star excursion balance test should be more than 90% of the uninjured side. Week 26 and thereon, triple hop, lateral hop, all of these can be started. Along with this, please start with single leg press 1.8 times the body weight. After management of acute ACL rupture with the cross brace protocol, 90% of the patients had evidence of healing at the 3-month MRI. More ACL healing on the 3-month MRI was associated with better outcomes. The cross bracing protocol and aggressive rehabilitation can definitely be a great alternative to reduce both cost of injury as well as management of the injury, and also reduce the time to get back to activities as well as on field for a lot of athletes. Remember, movement is medicine.